As a GP, our carers in our community are absolutely vital. We have a vast number of complex people who are frail, who live alone, who don't have family around them to support. And those patients of ours require the day-to-day support from the carers to be able to do even the most small things. You know, to get yourself out of bed, to wash yourself, to remain clean, to have some dignity about your day, to feed yourself. These are all things that we take for granted. But many people don't have the ability to do that for themselves. And without their carers' support, they would just not have a life that any of us would want.
A person's needs are met not just by regulated care, not by just someone going in to help them get ready for their day or to make sure they've taken their medication or whatever. A person has much greater needs than that. Our volunteers, they visit people, they give their time freely to ensure that they received the best possible rounded support to enable them to continue to live independently, and it's invaluable.
Too often we hear about social care when things go wrong and not enough celebrating when it goes right. I think there are lots of really good stories we can tell about how we are supporting people out of hospital earlier than they have been in the past and supporting them at home, how we're preventing people going into hospital in the first place.
What we are doing really well is we're starting to work much more in partnership around sharing skills, training, expertise, really reaching out and offering help and support, but equally understanding from other provider organisations what they need from us and how we can add value. So I think we already do that well. We could do that much better.
The carers that we have in our communities across Devon are doing the most valuable job and under the most difficult circumstances. COVID-19 has brought some extraordinary challenges, and they have met every single one of those challenges and continue to work day in, day out for the benefit of our communities.
There are eyes and ears. So if something is going wrong, if someone is deteriorating, they're often the first people to notice that and let us know. And that's why they're so pivotal.
It's vitally important that we continue to support them and to develop services to enable us to carry on this invaluable work in our communities.
People who work in this sector, we work here for a reason. There are many other places where we could work, and being able to make a difference to somebody's life when they're really often struggling is a great gift actually to be able to give.